all the best for the day. Therefore, I shall report the Devinagracias idea together with Miss Lamaga. So, I'll be proceeding in Devinagracias introduction. Carmelita C. Devinagracia, a member of the pioneer class in 1962 of the college, who succeeded Dean Emeritus Damdao. In 1960, the UERL Memorial Hospital was established to serve as the clinical laboratory for the colleges of medicine and nursing, and later on, the College of Physical Therapy. She has been a clinic staff and head nurse, instructor, assistant dean, and dean. Background and also lectured written about her work as a nurse, and she used her hand-on experience to develop better ways to teach nursing. In history and background, Carmelita Devinagracia is a Filipino nurse, former president of the Association of the Philippine Colleges of Nursing, which is the ADPCN, Dean of University of the East, Ramon Magsaysay Memorial Medical Center Incorporated, which is the UERMMMC College of Nursing. In history and background, she is a member of CHED's Technical Committee of Nursing Education, expert in research and education, and BSN at UERMMC in 1962, a Master in Nursing at the University of the Philippines in 1975. PH Doctor in Nursing at UP in 2001. She has been lauded for developing the art and competency of teaching nursing, and she has been a clinic nurse, staff nurse, head nurse, instructor, assistant DN and dean. In awards and honors, bachelor's degree in nursing at the University of the East Ramon Magsaysay Memorial Medical Center in 1962. Master's degree in nursing at the University of the Philippines in 1975. Doctorate's degree in nursing at the University of the Philippines in 2001. Recipient of the Anastasia Geronto Pass Award given by the Philippine Nursing Association PNA in 2008. In Devinagracias Nursing Series Composures Behaviors, Advanced Nurse Practitioner, you must be a BSN graduate and has a license and have a clinical experience of 2 years and has undergone special training in specialized areas. In Composure Behaviors, an acronym used by Devinagracias to enumerate specific activities that must be done by the advanced nurse practitioner. Wellness status, a condition or a state of well-being involved in wellness, a coordinated and integrated living pattern that involves wellness.
Wellness status, a condition or state of well-being involved in wellness, a coordinated and integrated living pattern that involves wellness. Ang wellness status, ito yung kalagayan ng ating pasyente. For example, sa hospital, ang nurse kapag morning, afternoon, and evening, gina-check nila yung pasyente nila kung kamusta na ba sila, ano na ba yung kalagayan ng kondisyon nila. And that is the example of wellness status. Let's proceed on competence. And definition of competence. Competence in deep knowledge and expertise of advanced nursing practitioner. Consistency and accuracy of word action by nurse. Okay. Having the skill or knowledge to do something well enough to meet a basic standard. In this case, kailangan natin ng karunungan, kaalaman, at care to assist the patient. Kapag wala ka nito, for example, pag wala ka nito, hindi mo alam yung gagawin mo. And let's phrases of prayer. Care in the form of being there during this period include therapeutic communication and active approach. Praying is highly recommended as provide most patient with assurance. Ang presence of prayer, isa sa mga example nito yung due date ng patient sa surgery niya is Siyempre, i-motivate natin yung patient natin to tell him that he need to pray and pray because God is always provide God move mysterious way na hindi natin namamalayan. And openness, being receptive the new ideas and concepts, able to accept opinion and methods supplied by patient or the other co-work. Open-mindedness is willing to consider an ideas in opinion and that are new different to your own. Stimulation, provision and motivation of the patients, reinforcement through encouragement, affirmation, and motivation are needed. For example, is papalakasin mo yung loob ng pasyente mo and to motivate na hindi siya kabahan if due date na ng surgery. Respect, acknowledge of the patient's needs, use of opo and opo as well as mood and gesture to display. Example nito is alamin kung ano ang kailangan ng pasyente and also hindi lang yung patient natin na magsasabi sa atin ng po at opo. As we nurse, we need to respect them. Hindi porkit na nurse na tayo, yung patient lang ang nag-po at opo. Relaxation, allow of resting period for the patient, activities that allow use of certain muscle while the other are relaxing. For example, then ang patient natin is need din ng pahinga para mapadali ang recovery niya. And also, hindi naman pwede na puro pahinga na lang yung patient natin. Need din nila ng exercise. And next is empathy. Empathy, able to relate to the hardship the patient is going through and share in the joys and sorrow of the patient while not being attached altogether. Empathy, for example, is yung naiintindihan mo yung hirap na pinagdadaanan ng patient mo. And that's it.
Once more, the nurse has exhibited most, if not all, composure behaviors. The outcome of the patient can be categorized into biobehavioral and physiological. In biobehavioral, refers to the perceived wellness of patients in terms of physical, intellectual, emotional, and spiritual aspects. In physical, the patient is able to do his or her daily activities and functions without fatigue. So, dapat hindi natin kailangan pagunin yung mga pasyente natin. In intellectual, the patient has properly applied all the steps the nurse has instructed the patient to do. So, as a patient, nag-utos yung nurse sa'yo, so dapat sundin mo yung mga step-by-step na pinapagawa sa'yo. In emotional, the patient is able to handle the stresses of life and can maintain and regulate his or her feelings. So, as a patient, so dapat lakihan nyo din yung ulo. Hindi yung kailangan na, hindi yung magpaka-stress ka, dapat kaya mo din kontrolin yung mga stress mo. Think positive ka dapat. In spiritual, the patient can properly establish a value system and act upon that system. The prayer is the answer. In achievement of composure's behavior, physiological refers to the perceived wellness of patient in terms of vital signs, bone pain sensation, and complete blood count. So, theoretical paradigm, composure behavior competence, presence in prayers, open-mindedness, stimulation, understanding, respect and relaxation, and empathy. In wellness outcome, in physiologic outcome, vital signs, chest pains, and hemoglobin. In biobehavioral outcome, which is the physical, emotional, intellectual, and spiritual. In assumptions, the wellness outcome of a patient will depend on the intervention the nurse has when administering the client. Ang resulta ng kalusugan ng isang pasyente ay depende sa intervention na mayroon ng nurse kapag pinangangasiwaan ang kliyente. In strength, Devinagracias model proved that nursing as a healthcare profession have a great significance in quality performance as other healthcare. Pinatunayan ng modelo ni Devinagracias na ang nursing bilang isang profesyon sa pangangalagang pangkalusugan ay may malaking kahalagahan sa kalidad ng pagganap tulad ng iba pang pangangalagang pangkalusugan. In limitations, the nurse who should use this model must be an advanced nurse practitioner only has undergone special training in specialized areas. Ang nurse na dapat gumamit ng modelo ni Devinagracias ay dapat na isang advanced nurse practitioner lamang na sumailalim sa espesyal na pagsasanay sa mga espesyal na lugar. In application to nursing practice, education, and research, nursing practice, composure behaviors inspire the principles of holistic care wherein a patient's wellness outcome can be achieved through a series of quality attributes of nurses, which caters every aspects of wellness, maybe it be bio-behavioral or physiological. Nurses, especially advanced nurses, practitioners are to be used the composure behavior when administering the client. Devinagracias composure behavior is used when providing care to the patient to achieve wellness. In education, to prepare students to use composure behavior for practice as a member of the professional community, to develop, hone, and guide nursing education through composure theory, made as a basis of different universities in the Philippines. In research, inspire nursing from different and quality theoretical and conceptual framework, made as basis of the other researchers. In conclusion, the socio-demographic characteristics, specifically gender and age, are related to wellness outcome of adult cardiac patient. A significant difference exists in the pre-test, post-test score of the wellness outcome after the composure behavior intervention in 3 groups. Nursing profession can actively deliver quality care through bio-behavioral caring interventions like the composure behavior because regardless of grade and social class, gender, age, and nationality, each one needs humane, caring, spiritually oriented intervention that can facilitate wellness.